Have you ever pondered about postpartum mood disorders and their implications on new mothers? These are psychological disturbances that can surface after childbirth. Their scope varies, extending from mild phases like postpartum blues to more severe types such as postpartum depression. It's essential to note here that major depressive disorder, MDD, also known as depression or clinical depression, is characterized by a major depressive episode, MDE. The two core symptoms of MDD involve a depressed mood or a loss of interest or pleasure, also called anhedonia. These disorders can considerably influence the health and well-being of new mothers, interfering with their capacity to look after their newborns and themselves. Comprehending these disorders is instrumental in guaranteeing the health and joy of both the mother and baby. Now, let's delve deeper into the specifics of these disorders. The postpartum period, a crucial time for both the mother and the newborn. This period begins immediately after the delivery of the baby and usually lasts 6 to 8 weeks, ending when the mother's body has nearly returned to its pre-pregnant state. This is a time of significant adjustments and healing as the mother's body recovers from pregnancy and birth. Hormonal changes during this period can trigger mood swings and feelings of sadness or anxiety, which are often mistaken as baby blues. However, when these feelings intensify and last for longer periods, it could be a sign of postpartum mood disorders. This period is very important for both the short-term and long-term health and well-being of the mother and the newborn. Thus, understanding the postpartum period is the first step in understanding postpartum mood disorders. Stay tuned as we dive into the most common of these disorders, postpartum blues, in our next segment. Welcome to Scene 3, following from our previous discussion on the postpartum period. Today, we'll be investigating postpartum blues, a common condition affecting 50 to 80% of new mothers. The question is it normal? Let's explore. Postpartum blues is characterized by a transient period of mild depression, mood instability, anxiety, decreased concentration, and heightened worry over the health of the mother and the infant. This is regarded as a typical emotional shift associated with childbirth. This usually kicks in 2 to 4 days after childbirth, generally endures for 48 hours, but can prolong up to 10 days. Worth noting, postpartum blues does not necessitate the use of psychotropic drugs. However, it's critical to be aware that those undergoing this condition are at a heightened risk of progressing to postpartum depression, a more severe mood disorder. Thus, while postpartum blues is a mild form of depression, postpartum depression is a much more serious condition. That concludes our exploration of postpartum blues. Join us next time as we delve further into this topic, examining postpartum depression in greater detail. In the previous scene, we discussed the postpartum blues, a common but less severe condition. As we move on to Scene 4, let's delve into a more serious situation, postpartum depression. Affecting 10% of new mothers, it certainly demands our attention. It's a form of major depressive disorder that can onset within 4 weeks postpartum. With a wide range of clinical presentations, symptoms can persist anywhere from 2 to 6 months. In some cases, they can last up to a year. Rarely, it may present with psychosis. The more severe symptoms include disinterest in the baby and even suicidal or infanticidal ideation. Postpartum depression doesn't discriminate. It can affect any mother. Yet, there are certain risk factors that heighten the likelihood, such as a previous history of mood disorders, psychosocial stressors like unemployment or marital conflict, and even the stress of a colicky or sick infant. Treatment often involves psychotherapy like cognitive behavioral therapy or interpersonal therapy. Selective serotonin reuptake. Inhibitors or SSRIs have shown short-term safety for breastfeeding infants, but the long-term effects remain unknown. In severe cases, electroconvulsive therapy may be considered. The prognosis? It's not just about the mother. Postpartum depression can have significant impacts on child development, increasing the risk of cognitive delay, insecure attachment, and behavioral disorders. However, treatment of the mother can improve the outcome for the child 8 months down the line through increased mother-child interaction. Postpartum depression is a serious condition, but with the right treatment and support, mothers can overcome it. Having taken a comprehensive look at postpartum mood disorders, we hope you've gained a deeper understanding of these conditions and the importance of recognizing and treating them. Knowledge is power, and we believe that by sharing this information, we can help to break the stigma associated with postpartum mood disorders. We invite you to join us on our journey to better health by subscribing to our channel, Medicine Health 360. If you found this video helpful and interesting, please give it a thumbs up. Your feedback is valuable to us, so don't hesitate to share your thoughts and experiences in the comments section below. We are here to support you and provide you with the necessary information to take control of your health. Thank you for watching, and remember, your health is in your hands. Stay informed, stay healthy, and we'll see you in our next video.